Hello, my name is Dr. Scott Young with Hearing Solution Centers, and we're here with Emily. And today we're going to talk about why we would call you. Coming right up. Okay, so Emily, we've talked a little about in another session. We've talked about why what happens when a patient calls us, but there's another part. We call it the outbound call. Okay, that comes from us to you. And we want to talk to you a little bit about why we do that kind of calling. So talk to me about some of the different types of calls that you might do out to a patient.
Okay. Some of the reasons that I would call you is because we do recommend getting hearing aids cleaned every 6 months. So I'll be calling you to get that scheduled. Also, we'll be calling if a patient's warranty is expiring. We definitely want to let them know.
Yeah, so
That's
like
very
our hearing
important.
aids are, and most of our hearing aids have a 3-year warranty. So you might be calling up for what specifically with that?
Because when the warranty is expiring, and especially if it's been a while since we've seen you, we really would like to get you in, get those hearing aids checked, cleaned, make sure everything is running correctly on that before that warranty expires, so that if it's not, we can send it off for repair under warranty and not out of warranty.
Yeah, which makes us really frustrated when we see something out of warranty, just out of warranty, or a while out of warranty, and we could have fixed it before it went out of warranty with that too.
That is frustrating when that happens.
Right. So what other kind of things do you do too?
So if a patient hasn't been in a while, we recommend getting your hearing rechecked because hearing loss can progress about every 1 to 2 years. And depending on the age of the hearing aid, it is important, especially as the aids get older, it's important to keep up the maintenance on those.
Right.
Get them cleaned, checked, make sure everything's running well, stuff's not building up on them. Because they're sitting right there behind your ear. You need to get that stuff cleaned out.
You're wearing it 16 hours a day, 7 days a week. I mean, I wear mine all that time too. I even go into the sauna and listen to my audiobook, and I'm stretching and in that hot stuff. With some of the newer technology, I mean, it still takes care of it with that too. But that's kind of why we have to use our vacuum systems, and that's what Emilee's calling up about. Sometimes she does some of that. Sometimes our audiologist does do that. That depends upon what goes on there. But as hearing aids get older, what also happens to them that you see? What other happens to the patients when you think about that?
Well, the hearing aids do. They're older technology at that point. They do begin to have more issues, especially when you're reaching, 4 or 5 year mark. You really begin to look at, okay, are there another option? Maybe I need different hearing aids.
Right.
And insurance can play a part in that, especially if you've changed insurances. There's lots of different aspects of, you come in, we need to look at them, look and see if they're maybe new as an option for you. And if your hearing has progressively gotten worse, those hearing aids may not meet your needs anymore.
Right.
And that's something we would definitely want to check as well.
And I think one of the things that we do, and we're working in concert with what Emilee's doing, is we look at 2 main issues. Number one, how's your hearing? Now, if someone walks in and they're 5-year-old technology, their hearing is exactly the same, and the technology is working perfectly for their needs at the time. I mean, there's always new things. The newest, coolest thing necessarily, but if both of those 2 things are dealt with, they don't need any help.
Right.
They're fine.
Get them cleaned and walk out happy.
Exactly. But if one of those 2 things are out of balance, then what happens is that if they're breaking, your hearing could be about the same, but if they're not working, then you're struggling to understand. If vice versa, the hearing aids are working, but but your hearing is a lot worse.
Yes, exactly.
Then we have the same problem, and so we're not trying to be a bother. We're not trying to push you on that kind of stuff. What we're doing is that regular maintenance.
Yes.
So as a dentist, a dentist, calls up and might be bugging you too. But if you let your teeth decay, it's not a real good thing, is it? Right? And it's the same thing that actually happens with our hearing technology too.
Right. And even patients who haven't kept up regular maintenance, 3-year mark comes around, those hearing aids could have been in a lot better shape.
Right.
If you'd have kept up with that regular maintenance. Same thing with your teeth. If you go in for a cleaning every 6
Right.
months, you can keep up with the health of your teeth. Same thing goes for your hearing.
Yeah, and so I think those are some of the things that happen. So we're gonna call, here and there, but I think it's gonna help for you to have that communication with us so that we know how to fix your needs. So if you like what we said down here, just like there. Also subscribe, check us out on the channel. So thank you so much for listening to us today. Thanks so much.